So we're going to talk about ventilation and compliance. Ventilation is inspiration and expiration, taking air in and putting air out. We have to have that exchange. The other thing that plays an important role in ventilation is elastic recoil. This is where the lungs actually relax after they've been stretched and expanded. One of the things in the elderly population, they lose elasticity as they get older. So your lungs are, you have to think of them like a rubber band. They're nice and tight and they can expand. And then as you get older, you lose that ability to be elastic and have that tightness. Compliance is the measure of expansion of the lungs. Compliance becomes decreased, and that in turns is difficult to inflate the lungs. Some of the reasons that you would have decreased compliance would be an increase in fluid in the lungs. This would be caused by pulmonary edema, ARDS, pneumonia. Another reason is because you actually have less elasticity. Things that would cause that would be your pulmonary fibrosis, or you just have something going on that's causing restriction in lung movement, and that would be a pleural effusion. So compliance is increased if there is a destruction of the alveolar walls and loss of tissue elasticity. So you'll see an increase in compliance when you have a patient who has COPD, which is chronic obstructive pulmonary disease. The other thing we're going to talk about for a minute is diffusion. Remember we talked about ABGs and we talked about the component PaO2, and I said for right now it's not important and interpret them. We'll get to it later. Well, now's the later. The PaO2 is actually a representation of oxygen that is dissolved in plasma. It's expressed in millimeters of mercury. The Pa just stands for partial. And then you have your SaO2, which is your saturation. This is the actual amount of oxygen that is bound to the hemoglobin. So that's the definition of your PaO2 and SaO2, and we're going to talk a little bit more about it when we get to the ABG component in your chapter. A little bit about ABGs. ABGs are drawn usually from the radial artery. It can be drawn from the femoral artery. When we talk about ABGs, I just want to remind you that on page 479, disregard the normal values because you have to refer to your need to know sheet, and the actual bicarb level is a little different. So that's 479. So disregard that box. The other thing we want to talk about is PaO2 decreases with advancing in age. You will also see a decrease in PaO2 if someone has living in a higher altitude or the barometric pressure is lower. You can also see a lower inspired oxygen pressure and a lower PaO2. There is a table, the 26-1, that kind of goes over above sea level, 1 mile above sea level. You guys don't really need to know that. You just need to know that it is normal to actually see a difference in the PaO2 level with advanced age and higher altitudes. So just a reminder on your need to know sheet, the PaO2, which I think on your sheet I have it listed as just PO2, the normal is greater than 80 to 100, and that is millimeters. And your SaO2 normal range is 90 to 100. And that's from your need to know sheet. Those are the two add-ons that we didn't talk about with your ABGs, because remember, we're doing respiratory, so ABGs are a very important component of the respiratory system, so they're going to pop up again. Those don't go away. The other thing we can talk about is you guys in long-term care and those of you that are in the actual hospital setting, and even in simulation, we talk about obtaining a SAT level on the patient. We're just doing a pulse oximetry. You do need to know that there are factors that can actually alter that reading. This is the one you just put on the finger. It's measured through the capillaries and you get a reading. It's not always accurate because sometimes things can alter it. Motion, low perfusion, patients with anemia, patients who have Raynaud's or they have super cold extremities, bright fluorescent lights, which is what is mostly in hospital, fluorescent lights, doctor's offices. Intravascular dye, if they have acrylic nails and dark skin, patients can also have an alteration in the saturation level. So we're continuing with a little bit more on ABGs. There is a table 26-3 on page 480. This goes over critical values for the PaO2 and the SpO2 or SaO2. So it just kind of goes over some things that possibly is going on. So you can see that if someone has a PaO2 level and they are at 55, so when you see an ABG and you have a level and it's 55, the PaO2 level is 55, it's just typically you're seeing patients who have hypoxemia, but they probably don't have any cardiac issues going on. This could possibly be a COPD patient because they're going to have chronic issues with hypoxemia and not having enough blood flow. The other thing we're just going to go over just a couple more things kind of as review is when we think of the respiratory center, we think of the medulla. The medulla kind of controls that. When we have changes in the hydrogen, so let's say we have an increase in the hydrogen. This is acidosis. And when we have that increase and we are acidotic, the medulla increases the respiratory rate to try to balance that back out. Remember, our body is very well designed in trying to maintain a homeostasis balance within itself. If you have a decrease in the hydrogen, this is your alkalosis. And this has the opposite effect, so your respirations would decrease.